Our speaker today is Haim Weinberg. And so Haim is a licensed psychologist, group analyst, and certified group psychotherapist. He's in private practice in Sacramento. He's the past president of the Israeli Association of Group Psychotherapy and the Northern California Group Psychotherapy Society. Dr. Weinberg is the list owner of the Group Psychotherapy Professional Online Discussion Forum, academic vice president of the Professional School of Psychology, in which he created and coordinates an online doctoral program in group psychotherapy. He wrote a book on internet groups and co-edits a series of books about the social unconscious. So here we have Haim. Thank you.
1, 2, it works. Thank you very much for introducing me. And first of all, I want to apologize. There was some misunderstanding regarding the time. I was told at first that we start at 10:30 and that I have 90 minutes to present. So I scheduled another presentation in Berkeley at 2 o'clock. I thought that 2 hours is enough to drive from here. And then last week I understood that actually I'm supposed to talk until 1, which is a problem. So we'll shorten it and do it until 12:30. And I will have to, most of my instructions to you, Bob, will be to skip slides, unfortunately. But I will try to condense maybe my presentation. As you can hear from my funny language, I'm not originally from here. I was born in Israel and moved to California 10 years ago. So if you don't understand something, it's because of my pronunciation. You can always ask, what do I mean? For example, I say chaos and you mean chaos or something like that. So I hope you will understand me. As Erika introduced me, I'm a psychologist. I'm licensed both in California and in Israel. And in my private practice, I do individual therapy, I do couple therapy, mostly EFT, but my version of EFT, you know, everyone has his version or her version of what does it mean to do EFT. And I also do group therapy. Actually, my expertise is group therapy, meaning that I do groups, I supervise about groups, I write about groups, I have many articles, I have books, as Erika mentioned. Here are 2 of them, one about internet groups, one about the social unconscious. I'm very much involved also in group therapy organizations. The local one is the NCGPS, the Northern California Group Psychotherapy Society. If you are interested in groups, there is a fall event, actually in 2 weeks. You can pass it and take some of it. What else do I do? Sorry for the promotion. I also direct an interesting group psychotherapy focused doctorate program. If any of you is interested in developing and having your doctorate in the Professional School of Psychology, I have some flyers. It's a very interesting program that is a hybrid of distance learning and face-to-face. And it suits very much the mature adult population, because you can continue your work, stay where you live, and still study and come once a year for face-to-face workshops. So if you want, here it is. I brought some bibliography for about the presentation that I am giving today. So here it is for you. It's a list of references if you will be more interested in this subject. Last but not least, in Sacramento, under the Sacramento Center for Psychotherapy, which is a corporation that I am incorporated, we do a series of workshops about the life cycle of the group. If you're doing group therapy or want to learn more about groups, here's something for you too. A lot of paperwork. Many times in the CE questionnaire afterward, there is a question about the handouts. And many times people say there are not enough handouts, that you cannot say that All right. So what I'm going to talk today is about relational approaches. Now, what does it mean, relational approaches? That's the first question. And what does it mean to be relational? It doesn't mean to create relationship. We all create relationship. But how do we really relate to other people in a meaningful way? Well, this secret I'm not sure that I'm going to reveal today because I'm not sure that I really know. But it's a question that perhaps we should ask ourselves. As therapists, what does it mean to be relational? The relational approaches, this is the outline of my presentation. I'll probably be very short about what is psychodynamic theories. The relational approaches are part of the psychodynamic theories. So I'll talk about them, I'll talk about group therapy approaches and the relational group therapy. You can move another. So we start with individual therapy. Has everyone seen the still face? 1 or 2? Let's put it, I know how to activate the 8 here. Yeah.
Babies this young are
I
extremely
didn't think about the volume.
to the emotions and reactions.
So I'll explain. This is an experiment where they told the mother
This is something every story study
not to show anything on her face to her baby for about a minute. Okay? She's playing still face.
She sits
All
down
right?
and she's playing with her baby who's about a year of age.
I'm like a girl.
Oh, sorry.
And she gives a greeting to the baby gives a greeting back to her. This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate.
Okay, it's difficult to hear, so you will miss the point. But
in the world, and that's
the
really
mic is the maximum. I didn't think.
is used to.
Okay,
And then we ask the mother
is it enough?
to not respond to the baby.
Maybe.
The baby very quickly picks up on this, and then she
No,
uses
you will not hear.
all of
The
her
baby tries to draw the attention of the
try
mother
and-
when she puts this still
She
face.
smiles at the
First by pointing, by trying to make her
The
respond.
mother looks
You
at
see?
her, she points.
By
Baby
talking, by
puts both
bubbling.
hands up in front of her and
His hands.
says, "What's happening here?"
He's clearly distressed.
She makes that screechy sound at the mother.
That's amazing. And
Come on.
I assume
why
that you
aren't we
feel
doing this?
already a lot of feelings.
Even in this 2 minutes,
cruel.
when they don't get the normal reaction. They react with negative emotions. They turn away. They feel
turns
the
away
stress of
as
it.
if maybe
They
this will
actually
help.
lose control of their posture because of the stress that
Cries.
they experience.
Okay.
And that's the end of it. Yeah, you can. I'll bring it back to the. No problem.
Oh, yes. Oh, what a big girl.
So we saw something quite amazing. In 1 minute, less than 1 minute, the baby became really distressed just because the mother did not show any expression and showed his or her distress in many ways, trying to draw the attention of the mother, trying to create some relationship. Okay? Now, I am sure that you felt a lot of anger, sadness, pity, whatever. Do you think that it will create a long-term damage? If it continues like that, if we're talking about, for example, a depressed mother that cannot respond to her baby, yeah, surely. But we can think about the fact that it can be repaired if it happens, because it always happens. People, mothers, fathers cannot be always attentive and attuned to their babies. So that doesn't mean that we create a continuous damage. Now think about therapy and about how some of us, I grew up with a more conservative psychodynamic therapy, which means actually, if we think about it, we put up the still face. We are supposed to be non-responsive. No, and usually we think about the allegory or metaphor of a parent-child relationship in therapy. Now, what does it mean? How come that we still, some of us, still think that we should avoid any human response because we need to be the blank screen for the projections of the patients? What about the damage? What about this experiment? So this is where the relational approach comes. The relational approach actually says that the whole idea of putting up the blank screen is maybe wrong. We can still use psychodynamic, psychoanalytic ideas in order to do good therapy, but we need to remember that we are part of the interaction. Okay? We cannot be there as outsiders. We participate in what happens, whether it's couple therapy or group therapy or individual therapy. Can you move a little bit further? So first of all, if we are talking about psychodynamic therapy, what do I mean? Do you know how do we define psychodynamic-oriented, psychoanalytically oriented therapy? I understand, I heard from Bob that some of you are Jungian or define yourself psychoanalytic, psychodynamic. How do we define it? What does it mean? Any thoughts? Yes?
I don't think it has to do with belief in the unconscious and the unconscious effects of how help the patient become aware of it.
Yeah, belief in the unconscious, and we want the patient to be aware of something that he is unaware. More? I think that usually we also think that the past influences the present in an unconscious way. But actually, if we define psychoanalytic, psychodynamic orientations, it means focusing on the transference and on the resistance. You know these words, transference and resistance? We focus on how the patient transfers, projects on us his or her past experiences, meaningful people from childhood, caregivers, and on the resistance, because whenever we try to understand, to become aware, there is something that blocks us. Okay? Now, pay attention that under these definitions, the patient is always projecting. We do not project. We might have a counter-transference, but not because we are problematic or whatever. He is a problem, or she is a problem. And he or she resists. We need to do something with the resistance. The word resistance is so negative and problematic. In general, I just want to tell you, I know that there is an urban myth, urban legend, the CBT wins, and the psychodynamic approaches do not show themselves. I'm sorry, this is a myth. Can you show the research? There is an empirical evidence that supports the efficacy of psychodynamic therapy. This is and you can go on. This is one of the, and the conclusion is patients who receive psychodynamic therapy maintain therapeutic gains and appear to continue to improve after treatment ends. Continue. More. Fonagy is a father of mentalization. Probably you heard about him or mentalization. And he lately, it's very late in psychiatry, that PDT is effective for depression, some anxiety disorder, eating disorder, and somatic disorders. It is not effective very much for PTSD, OCD, and and cocaine dependence. This is very interesting. For example, those of you who treat trauma know that we need to develop special techniques for PTSD and for trauma. And psychodynamic approaches are not enough for that. But, I
just have a question because my experience with internal family systems work, which is more of a depth-oriented approach, which works with parts, is that it is effective with some of the more trauma-based?
Yes, true. I very much agree. The reason why psychodynamic approach is not enough to treat trauma is because it is in the body. And we need to do something with the body. Yes. how it's a question, but if I understood your question, I agree with you. Okay? You can go on. It's just that I want to say that psychodynamic approaches are not dead. Okay? I'll skip that because just because of the time. This is the distinctive feature in a very interesting article about what is psychodynamic theory. And even if you don't think that you do psychodynamic, if you look at the features, you will find that you do it, although you don't think so. Focus on affect and expression of emotion. You need not be psychodynamic oriented, but usually that's what we want to do. We want the patient not to intellectualize, but to be in touch with what they feel. Also in psychodynamic approaches, it's not enough that I know that because my mother did this or that, I'm behaving this or that. This is not helpful. It's helpful when I am in touch with my emotions around it. Okay? Exploration of attempts to avoid distressing thoughts and feelings. This is called resistance, usually. Okay, defense mechanisms. But I don't think that we should title it resistance. We know that people have difficulty in going forward. If they haven't, then we wouldn't have any job left, actually. If we wouldn't have something to block us from going forward, then they will solve the problems themselves. Okay? Identification of recurring theme and patterns. It can be that I show the patient something that happens again and again in our relationship, in what he or she tells me about their relationship with their partner or whatever, and we work on that. Discussion of past experience. This is usually what we say about psychodynamic approaches that is different from many other approaches. Focus on interpersonal relationship, especially in the room, and the therapy relationship. As I said, this is a transference, and exploration of fantasy life. Fantasy life means dreams and also fantasies, not only thoughts and feelings. Okay? Now, do you agree that most of you are doing some of it? Yeah, okay, good. Let's go further. The relational approach, or approaches actually, say in one sentence that the therapist has an unconscious too. Now, I know that this will come as a surprise for you. You never thought that you have an unconscious, or maybe you thought that you had it, but not in therapy. But come on, why are we different from our patients? We're the same, actually. If they have an unconscious, I have an unconscious. And if their unconscious is influencing their relationship, their reaction, their patterns of communication with me or with others, of course, my unconscious is there too. The question is, what am I doing with my unconscious? But first of all, I need to simply acknowledge that. So, if the patient tells me something like, why did you call me when I was 5 minutes late? Are you anxious about something? Some patients do that. Less here in California, you know, people are very polite. They don't confront you. I'm coming from a different culture, you know, so I'm used more to confrontation. But people can say something similar about me. Now, if I don't have an unconscious, I say, what are you talking about? Oh, let's talk about you, not about me. This is a very good trick. Why not? Why not talk about me? Yes, you are the patient, you are the center, but maybe something is happening also in our relationship, not only because you projected or you distorted something, but maybe something is really there. There is always a real part of the relationship. This is a relational part. Okay? We continue. Very quickly, I'll try and explain more about the relational approaches. Very quickly, because we really don't have a lot of time. We believe in the relational approach that there is a co-creation of the therapeutic situation. Now, you are dealing a lot with couples, and couples usually will believe in the systems approach, even if you don't work systematically. The system approach says that It's not possible that one person in a system is responsible for all the problems. Okay? We see the couple and not only individual because the husband and the wife usually, it can be two men of course or two female, all contribute to the problems. So if we create a system of a therapist and a patient, it's a co-creation. It must be a co-creation. It's impossible that we are outside this system. All right? Now, then we need to re-examine the idea of transference and counter-transference. Because that means the transference, that I'm part of the transference. It's not, even if, let me give you an example from a group. Lately, group member was very angry with me because I intervened when he said something and I corrected him and tried to correct something that he said. Okay? He was very angry with me. Now, his anger was out of proportion. But I have to admit that I tried to correct something. Now, yes, it is because of his strict father and because he has very important issues to work on. But I did something. So then I asked the group to relate to that, and one of the group members said, you know, when you corrected him, I felt as if a father is correcting his son. So I said, yes, you are probably right. I probably did something like a father correcting his son, which is my contribution to this interaction. It's not that he distorted the reality and just projected on me as his father. I triggered him, and I shouldn't avoid it, and I should acknowledge that. You see, the conservative classical approaches, I wouldn't be part of it. It's all his problem. So, an understanding of transference and counter-transference. Transference is not only a distortion, I would say. Okay? It only has some grain of truth that we need to acknowledge and bring it to the situation. And you understand for resistance. Again, resistance means that you block something. You cannot work on something because it's too painful, not because you are a bad person, of course, because it's too painful. However, many times resistance is created because I, as a therapist, did something. So we only need to consider this possibility as well. It's not out of the blue, it's not in a vacuum. You say vacuum? Vacuum in Hebrew, vacuum. Okay. So resistance is actually coping with threat and non-verbal communication and labeling it as resistance is refining it. Okay, you can go on.
What do you mean by that, Haim?
That the word resistance is problematic. If I say you resist, I kind of blame you and it's all your fault. So I want to avoid saying anything about resistance and always remember that we did it together somehow. I need to examine what is my contribution to the fact that you couldn't continue.
Sure, but you still talk about it, you just don't label it.
Sure. I talk about what happened here, okay? But I'm not only saying what happened to you, I'm also saying it seems as if I did something that blocked you, okay? I did something that blocked you. Okay, this is something about transference. It's not sort of a distortion, rather as one way among many to perceive and understand experience. Continue. This is another thing about the analyst's contribution. We can skip it because of the time. I'll give you quickly a case example that might demonstrate well how I work as what I think is relational therapist. Of course, it's my understanding and interpretation to what does it mean to be relational. Okay, the case, I call it the broken lamp. At the end of the session, while writing the check, sitting at my office desk, usually you don't sit at the desk, of course, and tells me, Haim, when will you install this lamp that is on your table? It's been there for weeks. And is a very successful businessman, owning a big, let's say, construction company. This guy's details. He loves taking upon himself more and more big building projects, but he is restless and can never enjoy his achievements. Driven toward the next project, always. He cannot feel that he enjoys his achievement. He always needs to conquer another mountain. Okay? From time to time, he tells me about problems at work with his employees, and he never understands why they are so dissatisfied. He pays them well, and he thinks that should be all. Okay? He is married without kids, he loves his wife, but does not have much time to spend with her. He in his projects and job, of course. He has friends, but feels quite lonely and does not understand why. All week after that session, I felt I must do something and fix that lamp. In fact, I'm not very good at technical things, and I procrastinate about mechanical chores. I became worried about what would happen if I did not install it before the next session. I did not want Anne to look down on me. I was quite preoccupied with the issue. Now, you can call it countertransference, but you can also say something happened in the relationship, and maybe it has a meaning. It's not just my problem or his problem. We need to explore what happened. So I was so preoccupied and so worried that I didn't think about it. But then it dawned on me. What we need to do is talk about it. I don't have to do something to act out. We need to discuss it. So it dawned on me something had happened between us, and it should be part of the therapy session. It has to do with the relationship we developed, and instead of acting out my fear, I said, okay. Thinking deeper about it, I understood several things around this interaction and prepared myself well for the next meeting. So I thought about it, and I thought, I know him already. I thought, what happened? I prepared myself with several options and ideas. The next session started. At some point, Anne talked about one of his workers and wondered why he complained, although he is paid well enough. I said, I have no idea why this worker is dissatisfied, but I thought about something that happened last week at the end of the session between us and wondered whether we can learn something from discussing it. And looked very curious and surprised. You mean something that happened here? What is it? Well, I said, do you remember that at the end of the session, while writing your check, you commented about my not installing my lamp for weeks? I must say that it haunted me all week long. This is a relational approach. Okay? I say something about what happens to me. I am in relations with you. And at some point, I understood that I felt intimidated by your comment. Again, where is my authority? What happened? I'm losing all my power. It took me time years actually, to be able to say such a sentence. I felt intimidated by your comment. I thought that probably you are better in mechanical issues than I am. I bring competition into the situation, and was almost driven to work on this project so that it will be fixed before our next session. I wonder what you think and feel about it. You understand, what I did is opening everything, not everything, but opening what I felt. It doesn't need to know where it comes from, maybe in my history. This is not important. It's not my therapy. But we need to understand what happened in the interaction, and I invite him to explore what happened to him. Anne looked shocked. After a short pause, he said, so strange. A very good friend who works for me told me almost the same thing this week. She said that she never feels that she can satisfy me, and that I always make her feel not good enough. I hear it many times from people, and I don't understand. What am I doing to make people feel that I do not value what they do, or even to feel intimidated by me? I said, this is an important question. Of course, it can also be part of my psychology. But as you notice that it happens to other people around you, it might be illuminating to explore what do you do without awareness. The exploration took some time, and it became clear that N has a very judgmental attitude toward other people and feels superior to them. However, he conveys this attitude unconsciously, in very subtle ways, just by asking me, when will you fix this? I told him, I think about these sentences that your friend and employee said. I will never satisfy you, and will never be good enough for you. I have a sense that you know something about such a position, that you have heard these sentences or felt something like that before. This is my psychodynamic thinking. It must have come from. It's actually trying to take control in situations where he felt helpless when he was probably under this situation. It did not take him long enough to exclaim, "Wow, you wouldn't believe it." I wouldn't believe it. This is exactly what I felt as my father used to compare me to my friends, always talking about their achievements, never letting me feel good enough. That is so strange. So you see, my opening up about what happened between us and my invitation, I assume it was an invitation in safety conditions, to explore it, led him to understand something very deep. That nowadays, first of all, he is driven by achievements probably because of that, and second, that probably he is doing something to others what was done to him when he was young and helpless. Of course, we talked a lot about his feeling that his father was disappointed with him and how much he needed his father to see his achievements, to mirror him. It seemed as if unconsciously he adopted a defense mechanism through which he put other people in the inferior position so that he will never feel in that position again. He talked a lot about how he does not want to become vulnerable, feel weak, or lose control. He emphasized his need to be strong, in control, invincible, with such passion that at some point I felt as if it almost became a matter of life or death for him. He really was so passionate about, I need to be strong, I need to be in control, I should never show my vulnerability. So I said, it seems as if at some point of your life you have made up your mind that you will never be weak again. This is a kind of a shot in the dark, but I felt that there is something so strong, like a determination, like a decision. He became silent for a while. Then he said, "You're obviously right, absolutely right. When I was in college, we had this tradition of partying all over town. Young people in college. One evening, I joined one of the parties, bringing several girls as my companions. I don't know why, but the other men became so angry with me, they started beating me hard. In fact, they hit me, kicked me, and even when I fell down, they continued kicking me and broke my hand when I tried to protect my head. My face was full of blood, my skull hurt, and I was cut in many places. I was hurried to a hospital and had 12 stitches in my skull. I remember lying there on the floor, so helpless and weak. I never felt so weak in my entire life. I was hospitalized for several weeks. My parents never came to visit me. only insisted that we should sue these guys, which I did not want to do. I remember that at that point I made a decision never to feel weak again. This was after a few years of therapy, and I never heard this story before that. So it was really moving, and I told him how much I'm touched by this story, and how much he let me understand much more what ticks this clock. The main point is that by bringing my subjective feeling and opening up an interaction that we had, not shying away from disclosing the unpleasant feeling that I had, following his comment, we were able to go deeply into his inner world. But this example brings a sense of what does it mean to work relationally? I think that, okay, questions so far?
Very clear.
Very clear. We can go on. All right. We move to groups. And actually, I don't think that, well, let me consult with you, Bob. What I thought is, in order to talk about groups, we'll do some demo group. I see that some of the people, I mean, having volunteers, and I will lead a process group and show how I work in groups. We don't have a lot of time, so it might be difficult. Yes or no? You decide.
Yes, try.
Okay. All right. So I need 6 to 8 volunteers to come here and create a circle, and I will lead a 25 minutes demo group. I will ask the camera to be stopped so that we will have